Many people with disabilities often feel anxious about going to see a health provider. Sydney will share what helps her feel more comfortable.
My name is Sydney and I'm 16 years old. I like it when my doctor explains it to me and he listens to me when I get nervous.
Many people assume individuals with intellectual disabilities need assistance in taking their medications. Sydney will explain how she manages her own medications.
I take my own medicine and I have a reminder on my phone. I look at the label and I measure it out.
When youth with disabilities become adolescents, it is important for health providers to discuss how their disabilities can impact their health and ways they can help manage their health issues.
My doctor doesn't talk about Down syndrome, but my mom does.
In preparing for a visit to a health provider, many individuals with or without disabilities tend to focus on uncomfortable procedures they have experienced in the past. Sydney will tell you what she worries about when she has an appointment.
Getting shots, finger pokes, and I don't know what he's gonna do.
Health providers often wonder about the best way to provide instructions for people with intellectual disorders and assume people with ID cannot read. Sydney confirms that it is an individual choice and that you should always ask how they would like the information given.
My mom usually tells me, but my doctor explains it at the appointment. I like reading what my doctor wants me to do.
Parent and caregiver roles during a health visit may vary depending on the patient's skills and age.
I'm Kelly, and I'm Sydney's mom. Sometimes when doctors have asked questions of Sydney, it's hard for her to understand what they're asking, so I find myself trying to ask it in a way that I know that she understands it, because I know her vocabulary better than what a doctor might. So I do view my role as her parent to help her understand those questions so she can answer in her own words.
Many people think accommodations can be expensive and very time-consuming. Kelly shares how flexibility and creativity can make all the difference.
When I know that in the past, she's very nervous about getting shots and finger pokes. We've been lucky enough that the office that we go to is flexible. We don't always have to go to the lab because that makes her nervous. But they come to the room and they give her time to think about it and they explain what they're going to do. And they also can use numbing gel to numb the area where they're going to be finger poking or giving a shot. And so that would be out of the norm, but it has definitely worked for Sydney.
The role of a parent or caregiver during a healthcare visit may vary depending on the patient's skills and age.
Definitely as she's gotten older, it's hard to know how much responsibility to give her, but what I'm finding is when I give her something to do, she is more than up to the challenge. So some of the things that I've had to try to back away and let her take charge of is filling out her own forms when she can. She does her own medicine. She's very responsible. In fact, she tells us and reminds us that she has to be taking her medicine at times. So we've kind of given her that ownership. She has a phone reminder, but she doesn't need it. She remembers her medicine, she knows how much to take, and so we've tried to pass that responsibility on to her. So those are kind of the two big ways. I think something that I need to probably let go of is even let her schedule some of her own appointments. And I would probably have to do that by calling the office first and letting them know that she would be calling, and so that they can have patience with her, because it does sometimes take her a little bit longer to say what she wants to say. But I do think that's a skill that she needs to learn, and I know she's very capable of it. I just need to let go. I'm not an expert in the medical field, but I am an expert of Sydney. Listen to what I have to say, listen to my concerns, and work together to figure out the best way to either treat her or to communicate with her. I think it's worked better when there's more of a partnership. I've gotten more confident, and it's easier to do that as Sydney's gotten older because I've had more practice being an advocate for her. But I will say that it wasn't easy to ask those questions or to constantly be bringing things up when she was younger, because I was nervous. I didn't want to make somebody feel bad or anything like that. But I think, as Sydney's gotten older and I've had, more experience, it's a little bit easier to keep bringing up my concerns or my points.
Parents and guardians may choose to leave a provider or a practice if they feel the health provider was not interested in learning how to support someone with a disability.
I have left one provider over the course of her 16 years, and it was because they didn't listen to me and I didn't feel like they respected Sydney. And I think it's important to know that they are people first, and that they maybe need extra patience, extra time. And I knew after one appointment that wasn't going to be the case, and I did actually move on. What I've found over the years is not all medical professionals have experience working with people with disabilities and have the medical knowledge that sometimes is needed. And what I've also found is there are doctors that do, and there's medical professionals that can be helpful. So if you're in a medical professional that maybe doesn't have all the answers, to reach out to those that might. And I know that as a parent, I don't want to have to feel like I'm educating the medical professional about Down syndrome. I would like them to reach out and find that information, because I did have to leave at one point because they really didn't have the experience and the medical knowledge that they needed.